Hey everybody, I am Dr. Diane Hayden, publisher of Natural Nutmeg Magazine and Essential Naples Magazine, and welcome to our Path to Healing conversations with our expert practitioners. I'm excited today to have two lovely ladies with me. We're going to be talking about all things related to natural treatment for cancer and cancer prevention, and this is an exciting topic. We have a lot to discuss. I've got a bunch of questions for them myself. And as I said, if you have any questions for those of you who are on the call tonight, feel free to pop those into our chat and I will make sure that we get those rolling as well. So I want to introduce my two panelists here. I have Dr. Yvette Witten. She is a board certified naturopathic oncologist providing comprehensive metabolic and highly individualized cancer care guided by advanced genomic analysis, nutritional therapeutics, and mind body support. Her approach treats you, not the disease, honoring your story, your physiology, and your spirit. Patients feel empowered and guided with clinical excellence and genuine compassion. And her practice is in Monroe. Her website is www.adonaiOHW.com. So welcome, Yvette. You want to just say a few words, say hi to our group, and anything else you want them to know about your practice?
Well, hi everybody. As Diane stated, my name is Dr. Witten. I've been practicing naturopathic and integrative oncology for quite some time now, and I have to say that my why and how this all started, how this journey started for me, was when I lost my mom to metastatic pancreatic cancer. Of course, she was diagnosed late, and so at the time of her diagnosis, she had extensive metastatic disease. It was everywhere except for her brain at that point. They were not expecting her to have very much time at all. And when I had gone to Florida to bring her back, I was told I couldn't because she would not make it off the plane. But I have to say that we had 6 months of quality time with my mom before she transitioned. And her transition was so peaceful that she did not have a lot of those devastating symptoms that generally is associated with adenocarcinoma of the head of the pancreas. So all I had or all I knew at that time was the Gerson therapy. So that was the only tool I had in my toolbox, and that was able to give us what it gave us. So now I know a whole lot more, and so that is what I do. This is, what keeps me going is to help people on their healing journey.
Oh, thank you so much, Dr. Witten. Thanks for sharing
You're
that
welcome.
story. Yeah.
Sure.
And I'm also excited to have Dr. Corinne Verano. She is also a naturopathic physician. She was given a 50-50 chance of surviving bone cancer at 12 years old. She beat the odds after finding naturopathic medicine and incorporating its therapeutic modalities with conventional therapies. And she has dedicated her life to researching ways to enhance conventional cancer therapies and target cancer cells with naturopathic modalities. She's practiced oncology healthcare for 22 years and now practices at Roots Natural Medical Center in Columbia, and their website is www.rootsmedicalcenter.com. So, welcome, Corinne. How are you today? Tell us a little bit about you.
Hi, thank you, Diane. Yes, so I am a long-term cancer survivor working on long-term survivorship and working on starting a survivorship clinic here as well. I became interested in naturopathic oncology when I was diagnosed and treated. Back then, I mean, we're talking 30 something years ago now. So, we didn't have the support medications that we have now in the conventional world. So I was very, very sick, hospitalized for 2 years. So my mom found a naturopathic doctor, and that's kind of how I got interested in naturopathic oncology, and then proceeded on to nursing school and then naturopathic school and then an oncology residency, and then my board certification in naturopathic oncology. So my practice here in Columbia, Connecticut is in a naturopathic center with another physician. And we've added many treatment modalities to our facility, some nutrient and a nutrient IV infusion center and hyperbaric oxygen chamber, colon hydrotherapy, hyperthermic treatments, acupuncture. and some other modalities for detoxing and massage therapy. So our facility is more, it's a center that provides many naturopathic therapeutic modalities, as well as the traditional office visits and nutrition consult and guiding and supplement guiding and building a therapeutic plan that meets people where they're at, whether they're getting conventional chemotherapy and immunotherapy, or just wanting to go naturopathic as a sole source of treating for cancer or therapy for cancer. So yeah, we're growing and expanding every week, I feel like.
Awesome. Thank you so much. Yeah. So I'm going to ask you both a number of different questions that are kind of like general things, and then I have specific questions for each of you based on, you know, the type of practice that you have. But I think there's so many facets to this, right? Because when you talk about cancer, you know, first of all, it's what type of cancer, right? It's, you know, what stage are people in? It's how fast does one type of cancer progress versus another? And is it based on genetics and all kinds of things like that? We could talk about cancer prevention, you know, things, you know, all different types of natural therapies for that. And so as I was putting through like the questions today that I came up with today, I'm thinking to myself, wow, like there's so much, right? Like one of the questions I want to ask you guys is, can cancer or certain types be successfully treated by natural therapies alone? And that's like a loaded question, right? Because you might answer yes, no, maybe, depends on what kind of cancer, depends on the person, that kind of thing. So I think what we're going to be doing tonight is just getting a lot of philosophy out there, like your past experience, your own experiences, your experiences working with the patients that you have. And there is no one size fits all, which I think it's just like a lot of other chronic diseases, it's so individualized that anyone who's on this call tonight or listening to this recording after the fact, I really encourage you to reach out to these two ladies, because I think we're going to touch on things tonight, but I think it's going to be a matter of you have to really go a lot deeper, you know, in terms of this. But what I hope to accomplish is getting into a lot of information about more cutting edge, more recent types of therapies, specifically what the two of you do, and hopefully get a lot of questions answered for people. So let's start with that. You know, what is your philosophy? Can certain types of cancer be treated by natural therapies alone, or do you always recommend like a combination conventional plus natural approach? And I'll let you guys just, you know, whoever wants to start can just jump in.
Well, I think I tread lightly with that question because, you know, of course, we know that, you know, standard of care is recommended once you have a cancer diagnosis. But I will approach this from the standpoint of there are instances where, you know, standard of care fails a patient. And so, you know, at that point, when they have no other resource, a lot of patients will come to us and ask if we can help. And my question always is, there's always something that we can do to help. There is always hope. Now, are there people who have recovered from cancer just using natural modalities? Yes. And Kelly Turner's book shows evidence of that, right? Radical remission, radical hope. There are people who have recovered from their cancer using only natural modalities. But when we're talking integrative oncology, when we're talking about integration, what we're talking about is bridging the gap between standard of care and evidence-based complementary and alternative medicine to optimize outcomes for the patient.
Mm-hmm.
Yes, I completely agree with Yvette in that the research, the published research does show that by combining conventional and naturopathic oncology modalities provides the best long-term outcome. So I have had many patients come in my office and say that they are absolutely refusing chemotherapy. And I look at the research and I say, but with your type of cancer, having chemotherapy with naturopathic modalities could be a cure. So instead of omitting a potentially curative treatment, let's look at how we can support your body through that treatment so that you don't. I think there's a big fear factor of side effects. And so people come in and they say, well, I don't want to be sick. I want to still be able to work in my job. I want to still be able to work in my garden. I want to still be able to ride my bike on warmer days. And you can still do that and receive chemotherapy. I've had patients maintain a full-time job through chemotherapy. Because there are naturopathic ways and means to support the body through chemotherapy so that you don't get all of those negative side effects. So sometimes I end up counseling people back into being willing to try chemotherapy because I know from a research perspective that that's their best option for a cure. There are some cancer cells and some cancer locations that can reach no evidence of disease or remission with just naturopathic modalities. But the majority of them do require chemotherapy to reach remission or no evidence of disease. And for some people, that's not the goal. I had a woman come in today who just said, I'm not looking for years to be added to my life. I just want a good quality of life. And she's okay with not extending her life by 5, 10, 15 years. She said, I would rather have 2 really good quality years rather than an extended period of time without the quality. So everyone's goal and focus and definition of successful treatment is different. So I think meeting each individual where they're at and creating a customized plan to help reach their goals is what the conventional world is missing. They just look at a diagnosis and say, this is what your treatment is, without hearing what the person's individual goals are.
Yeah, I think you hit it when you said the fear, it's fear, right? Like, I think people have heard so many horror stories about, just chemo and the more conventional treatments for cancer, and they're like, nope, it's, half the time it doesn't work or whatever, or it puts the body into, an even less, state to be able to fight things off. I'm not doing that or whatever. But there's been so much progress, I think, in terms of these types of treatments that now it's great what you're saying that, yeah, like, wow, there's certain things where, chemo combined with natural therapies is definitely the way to go. And maybe we should, help people pass the fear of some of these things to understanding how it can really help. And again, it's all the individual thing, right? Like, from what type of diagnosis it is to that person's mindset in terms of what path they want to go down. So let's talk about more specific natural therapies. So obviously, I'm assuming food, nutrition, diet plays a huge role in terms of how you would educate your patients in terms of treating them from that natural perspective. And then we can talk about specific supplements and things like that. But just like starting with the basics, how important really is diet, and what do you recommend from that standpoint?
So I started first, so I guess I'll start again first. So diet is extremely important. Okay. As we know, food is medicine if used correctly. I think even coming from a dietary perspective, it also needs to be personalized for the patient. And thankfully, we do have ways of testing, blood tests, etc., to and also with genomic testing to try to help us to personalize the diet for the patient. I know there's a lot out there about the ketogenic diet, and its role in adjusting or interacting with the cancer metabolism. But that might not be something that's for everyone. I know with metastatic disease, the research shows that ketogenic diet might not be the way to go. So what I do is I start with testing, but in general, what is recommended is a low glycemic anti-inflammatory diet. And that's where we would start, is to test the patient to see which foods are causing an overexcitation of their immune system, that's causing their immune system to basically dominate via that Th2 response, which is that humoral response where the B lymphocytes are making plasma cells, and those plasma cells are making proteins, which we call immunoglobulins, which are antibodies. So it is not normal for our immune system to be producing antibodies when we're, against the foods that we're eating. So we have to kind of look at that and assess why that is. We're looking at gut inflammation. We're looking at leaky gut, or, gut permeability issues. And so we want to correct those issues, because we're not what we eat only, we're what we absorb, right? So what we eat, we need to absorb. We need to be able to process those micronutrients out of what we're eating, and be able to have those accessible for the cells. And, from the spiritual aspect as well, we're not just what we eat, we're what's eating us, right? So if we have a lot of stress and things that's causing us, unresolved conflicts, trauma, etc., that also needs to be addressed in order for the body to move forward toward healing.
Great. Corinne?
Yes. Sorry, I had to take myself off of mute. Yeah, so absolutely. Nutrition is a huge modality in naturopathic oncology, because what we put in our mouth tells our DNA how to function. Just like Dr. Witten was saying that, different foods create different immune responses in different people. So identifying those foods that are inflammatory, eliminating those from the diet. Our body is designed to heal and repair. So, and our immune system is designed to identify non-self cells and get rid of them. So one of the influential factors in creating a nutrition plan for someone with cancer cells is, okay, looking for things that are hindering the immune system from identifying those non-self cells and getting rid of them before they turn into a tumor or a malignancy. Nutrition is just one of the tools to enable proper functioning of our immune system, bring down systemic inflammation, limit nutrients that cancer cells like to use to multiply and divide and thrive off of, and provide the tools our body needs for immune system regulation and to heal and repair tissue. Because cancer cells cause tissue damage. So to heal and repair tissue damage, we need certain nutrients to do that and give our cells the tools that they need to heal and repair. So nutrition is definitely a huge component. A lot of my patients come in and say, oh, my oncologist said I can eat whatever I want. It doesn't affect how my cancer cells respond. And I'm sorry, but that's just speaking from a place of lack of knowledge, because our DNA responds to what we put in our mouth. And so the other thing is that a lot of my patients are given statistics, and they're told, if you don't do chemo, you will be dead in 6 months to a year. And or even if you do this chemo, it will only give you 3 more years to live. And those statistical analysis, those numbers that they throw out, are based on people eating a standard American diet, living a sedentary lifestyle. So what I tell people is, just by changing the way you're eating, you're already putting yourself outside of those statistical analysis and those research studies that are done on overall survival and progression-free survival from, like, say, gemcitabine or carboplatin or a chemotherapy drug. That study's not taking into consideration the internal environment that you create through what you put in your mouth. So if the only thing that someone did was change their nutrition, the way they're eating, that already increases the effectiveness of conventional therapy and increases potential overall survival. So nutrition is huge. Yeah, definitely a big part of our treatment modalities.
Yeah, and one thing another theme that I heard through here, I mean, Yvette, you said the word stress, and Corrine, you were talking about basically what people are told when they get a diagnosis. I mean, if that doesn't cause stress, I don't know what does. But let's talk a little bit about that. I mean, we know the impact of diet and nutrition, but I would imagine that, you know, how many people do you think can get a diagnosis like this and not be completely stressed out? I mean, and what do you recommend, or what do you do with your patients to try to get them out of that cycle? Because I would almost venture to say that maybe that's even worse than the diet is the amount of stress that someone is under during a diagnosis and treatment. And what are things that, you advise them to start doing for themselves, self-care, that kind of thing, to kind of, to help basically, because stress is, we know it's the worst thing for pretty much any kind of disease, let alone a cancer diagnosis.
Yeah, absolutely. Because, even, a lot of my patients, not all of them, but quite a few, too many, as far as I'm concerned, have told me that, just the delivery of the diagnosis to them, over the phone or nonchalant, and, not providing that supportive caring environment, even, to even deliver that news. And I think every oncologist should have in their office a bottle of rescue remedy, right, for their patients, prior to delivering this diagnosis, because just hearing that, people associate a cancer diagnosis with death, right? And so that immediately will trigger the cell danger response. And so managing that stress and, that autonomic nervous system, and trying to, make sure that they're not sympathetic dominance, where they're, in constantly in that mode where they're looking over their shoulder for the saber-toothed tiger that's not there. And so it's really important to address the autonomic nervous system, to address, vagal tone, and so just going out and taking a walk in the woods. My early mentor, Dr. Lise Auschler, talked about forest bathing, and there is science that's supportive, behind that. If you go in out in nature and you walk on a trail, that's able to calm your sympathetic dominance and help you to switch to parasympathetic mode, which is rest and digest. Deep breathing, just setting your alarm 10 minutes in the morning, 10 minutes at night, to just practice, deep breathing. There's all types of deep breathing. There's prana breathing, all types of breathing, but just taking that time to quiet yourself, and to do some breathing, that is helpful also as well, for resetting the autonomic nervous system. The other thing is, if you meditate, that's great. Some people find it really quiet, especially, can you imagine you're being told that you have cancer and now somebody's telling you to quiet your mind? But, a lot of the recommendations that I make available to my patients, if you try to use some type of frequency, like 432 hertz is healing. It helps to bring the brain wave into theta wave, which is a meditative state. So using these sounds and these frequencies to help to quiet the mind, that's a way to start out meditating. And then eventually you can learn to, without any help or assistance, is to just by focusing on your breath to be able to quiet your mind. Touch therapy is amazing as well, right? Because the body is meant to receive touch. And so, a lot of times cancer patients, when they're diagnosed, they feel as though they're alone, or they might, isolate themselves. But, even just putting into your calendar to go and have, a massage. Like, we don't want to do deep tissue massage when a person has a cancer diagnosis, because the blood becomes more viscous and thicker, because cancer is an inflammatory disease. So we don't want to do any deep tissue massages, but just a very gentle Swedish, or Effelraj is the name of the stroke. That is helpful also for calming the body. So journaling is another thing that I tell my patients to do. There's a book called the Clarity Cleanse by Dr. Habib Sadeghi, and it's a wonderful book. But part of that book, he has what I call is a purging activity. And so I tell my patients, set your alarm for 12 minutes. Get loose leaf paper. Don't write in a journal, because a lot of times we hold ourselves back from writing freely, because in the back of our minds, we're thinking about who's going to find this journal and who's going to read it. And so I have my patients use loose leaf paper. And so within that 12 minutes, I tell them, don't worry about grammatical errors, spelling, none of that matters. Just write what you're feeling in that moment. And then when you're done, don't even go back and read it. Do not. And so energy, as we know, can't be created or destroyed, but it can be transformed. And so what I have them do is take those pages, and I say, find yourself an old coffee can or something that's made out of metal, and put those pages in there and burn them. And a lot of times I'll tell them, because when you burn something, it's carbon, right? And so I'll tell them, if it's the summer season or they live somewhere where they have access to the beach, you can go out there and just let those ashes go and be taken away with the waves, right? So now you're creating a clean slate. So these are just some of the ideas that I can offer to my patients.
I love it. I love it. Corrine, how about you?
I love those. So yeah, just a lot of my work with patients is kind of talking them down from the stress that was placed on them that day or that week by one of their conventional providers. And I remind them that knowledge is power. So you don't have to make it. They also get pressured to make a decision like that day. Like, yes, are you going to do chemo, or are you going to get a port? Are you going to do surgery? Are you going to do immunotherapy? It's too much information in one day. So I tell them, like, take some time to digest. Cancer, a tumor didn't grow overnight. I mean, it was probably months in the making. So taking a week to think about things and review everything that was spoken is not going to make or break an overall survival outcome. So take the time to digest and metabolize what was said. Also, knowledge is power, and get knowledge and understanding of what your options are, what your choices are, because a lot of times their oncologist will say, this is your only option, take it or leave it. And that's not the case. In most situations, there's always other options to either enhance the conventional recommendations, or maybe there's another way. So I talk to people about gaining knowledge for themselves and making an informed decision for their treatment plan, and understanding that their oncologist is speaking from a perspective of a protocol, and that's the only option, and they're speaking based on you not doing anything else other than what they're recommending. So what their projection, what their prognosis speech isn't accurate for someone who's changing their diet and lifestyle and doing mind body medicine and incorporating targeted nutrients. So I also advise people to incorporate some sort of movement, because movement is medicine. So whether it's walking or pedaling on a stationary bike, taking a walk in the woods, whatever form of movement you're physically able to do will be helpful. It'll help balance the sympathetic and parasympathetic nervous systems and help balance the neurotransmitters. And as Dr. Whitten said, activating the parasympathetic nervous system and getting the thoughts to calm down. Movement is huge, and also massage. We offer a lot of massage therapy here, both very light, gentle touch, and moving emotions through the body. So even helping people with processing information they've learned through physical touch and moving their emotions through their body to help their body tissue not hold on to some of that stress, and kind of releasing that stress through a massage therapist. And then also I tell them whatever is relaxing for you. So for everyone, it's different. For some people, a bubble bath is what activates the parasympathetic nervous system. For some people, it's yoga. For some people, it's walking their dog. For some people, it's riding a bicycle. So whatever movement or whatever activity is relaxing or calming for that individual, I try to help them identify that and then encourage them to pursue that on a daily basis, just to help with the stress response.
Yeah, I think what's important to come back to what you said about taking time after a diagnosis. I mean, as soon as you said that, it reminded me, I had a really good friend who was diagnosed with ovarian cancer a few years ago. And one of the things she said to me that was quite shocking was like, she's like, "Oh my God, I'm in the system now." And I'm like, "What do you mean you're in the system?" And she's like, "Literally, as soon as I was diagnosed, I had appointments being scheduled for me with all these different kinds of doctors, you name it, oncology, radiology, all the doctors that do all these different types of testing. She had like all these test procedures scheduled, a whole plan. I mean, it was like overnight almost, and her schedule was booked out for weeks with nothing but just these doctor's appointments. And she's like, "I'm going here, I'm going there, and whatever." I'm like, "Oh my gosh, like talk about adding more stress to the situation." It seemed crazy to me. You're muted.
Yeah.
Yeah. Oh.
Yes, there's so much pressure to get things done right away. I have patients who are
Yeah.
diagnosed, and then the next day they're in the OR getting a port placement, and then the next day they're getting chemotherapy, and they're like, "Whoa, what just happened? I just found out I had this diagnosis." And
Right.
they're just, swept into a system and set up with multiple visits, multiple consults with different doctors. So it's a lot.
Yeah, yeah. So I
Yeah.
think it's
And
important to take time. Go ahead, Yvette.
absolutely. I would just add to that, there's always this great sense of urgency, but it's important also to understand and know that way before that lump or that bump showed up, that whole cancer process was in place. So you certainly have time to obtain a second or even a third,
Mhm.
um, you know, uh, see an oncologist and get a second or third opinion. You have time for that. You have time to educate yourself about your diagnosis. You certainly have time, and there doesn't need to be this urgency like something needs to be done yesterday, because you are the person who's serving as host to the cancer. There's a saying that it's one of a favorite quote of mine, that says that the patient comes to us with the healer within them, right? And so we are at our best as physicians. It's Albert Schweitzer. I struggle with saying his last name, but I love this quote. So we are at our best as physicians to let the healer within them come forward and do its job. And so we really serve in the role as docere. That's one of the tenets of naturopathic medicine, where we're teachers and we're facilitators. But the healer resides within. Okay, so when we're able to give the healer a chance to go to work, that's when the person can really begin to heal. So I just
I
wanted to add that.
I love that you said that. Yeah, because I think we forget about that, right? And we're looking externally for all these people to fix us. And one of the things when my friend got this diagnosis, one of the things I did was I was reading a ton of books, a lot of spiritual books on how to help people, with a cancer diagnosis. And I'll never forget. Now I wish I could remember which book this was, but there were so many. But one thing that stuck out for me was one of the authors said, you are not your diagnosis. Stop identifying with the cancer. Stop making it like your identity. You do have a healer within, like you said, and you need to focus on almost becoming a different person, right? Not the person that was diagnosed with cancer, but becoming a healed person. And so stop identifying with the diagnosis. I would say that for any diagnosis, honestly, just, not cancer, but any kind of like chronic disease or thing like that. I feel like we get really caught up in it becoming who we are. Like, I have to fix this, or now I'm this, or whatever. And if the focus should really be on, okay, who was I before I got this diagnosis? And who am I as a healed person, right?
Yeah. And even those words that we use, like combat, right? I'm fighting the cancer. And so I always tell my patients, look at it as, trying to find a place where, the body can be restored to harmony. Okay. Rather than seeing cancer as something that you need to kill or launch an attack against, because you are housing the cancer. So it's looking at, what is creating that environment so cancer can thrive in the first place, because we all have cancer cells within us at any given time. So it is not true to say that we can eradicate cancer, because we can't. And what standard of care does not offer, with the chemotherapy, the radiation, and the surgery, is that you have that stemness. So you have those stem cells, those aberrant stem cells, with that WNT, WNT, and the Notch pathways. And, those aberrant stem cells they will lay dormant, and they will wait until, your treatments are done. And they have the potential, more than likely, to come back more aggressively. And what worked to treat them in the first place will no longer work. So, it takes a comprehensive approach, because cancer is very, very complex. It's like, playing chess. There's no magic button that you can hit that button and you're going to eradicate cancer. That is certainly not true. And I don't think we can even say that in the conventional realm either, right? Let's be honest. I don't think we can say that. Yes, we can, we can shrink the tumor, right? Which is what conventional medicine does. We can cut it out. It's like cutting down the tree, and you're getting your stump grinder. I'm using these terms because my ex-husband was a landscaper and an arborist. So you can grind that stump down, right? But the roots are still below the soil, and those are the stem cells. So those need to be addressed. And that's what a comprehensive integrative treatment protocol or approaches can do.
Mm-hmm. So Karina, I want to ask you something specific about your practice. Is there anything that is cutting edge, or some like a favorite treatment that you like? And again, I know this is completely it's going to be different based on what type of cancer and all that kind of stuff, but anything that you want to just tell our listeners about that you've discovered recently, or something that's tried and true, anything you want to talk about in your practice that you use?
Sure. So we use a number of modalities. I know I mentioned a few: IV nutrient infusion, colon hydrotherapy, detoxing, hyperbaric oxygen therapy, EWAT, which is another form of oxygen therapy, acupuncture, massage, biocharger, which is basically a Rife machine on steroids, and then phangotherapy, which is a hyperthermic detoxing therapy. So those are all the modalities kind of on site that I create a combination of for each person. As far as like latest cutting edge. We also do like RGCC testing, which looks at circulating tumor cells and circulating tumor cell DNA. One thing that I'm pursuing, well, two things I'm pursuing currently because I'm fine. I was not against them, but I wasn't a believer in them until recently. When I've started investigating them a little further, is we're going to be adding some ozone therapy to our treatment modalities for specific cancer types, and then not IV ozone because that's illegal in the state of Connecticut, but we're going to be doing ozone insufflation therapies. So we're kind of experimenting with that now, and I'm finding a lot of benefit with especially colorectal cancer patients and doing rectal insufflation with the ozone. So we're working on that. And then also dendritic cell therapy. So dendritic cells are antigen presenting cells that kind of show our immune system the cancer cells and to target them. So it's basically identifying specific protein markers or peptides on the surface of cancer cells and then tagging them for the immune system to attack those cancer cells. So it's a therapy that we can do through the RGCC. We have access, and I've had a couple of people call and inquire about it. But for my own, I'm the type of person where I need a lot of research evidence to add a therapy to my practice. So it's one of those therapies that I'm investigating and kind of playing with adding to our infusion center, our IV infusion center. And then ozone therapy, I'm actually flying to Nevada in June to get an official ozone accreditation to be an ozone center. So we're kind of adding that as well. Awesome. So from a naturopathic standpoint, those are kind of I guess you can call them cutting edge because they're kind of, especially the dendritic cell therapy, that's kind of a newer thing in the naturopathic world. And then ozone therapies, which I wasn't a huge fan of in the past, adding another gas to the human body, but I am seeing it significantly drop tumor burden and the people who have signed a very special consent form to do that here. So we're working on it.
That's great. That's great. Thank you. And Yvette, you can talk about this or you can talk about something else. I know you wrote an article for us about methylene blue. I'm not sure if that's what you would choose to speak about. I know people, someone actually asked me a question about that. I'm like, well, I have to ask her. Is she going to talk about that?
Yeah. So I do have the advantage, even though I'm a naturopath in the state of Connecticut, where our scope of practice is quite limited. But I do have a medical doctor who serves as our medical director. So we're able to also offer ozone. We're able to offer mistletoe infusions as well. I have completed the advanced mistletoe training through the Physician Association of Anthroposophic Medicine. I also took the training in Germany, by the way, as well. We do also offer colon hydrotherapy. I am myself an IACT certified practitioner. So that's the International Association of Colon Hydrotherapy. And I do offer energy medicine in the form of pulse electromagnetic frequency. Our technology that we have is technology from Germany. I know there are different forms of pulse electromagnetic frequency devices, but that I bought back from Germany because I am affiliated with a cancer treatment center in Germany. And so we do offer that. It has an amazing way, depending on how you program it to make the cell membrane more permeable. So we have that in our IV room where our patients can actually sit on the mat while they're having some of their infusion treatments. And then with methylene blue basically acts at the level of the mitochondria with apoptosis, which is programmed cell death. A lot of times when you have certain mutations, that switch is blunted because there's not enough energy. So the methylene blue, we can use that either orally or via IV. Also, methylene blue is a nootropic, so it's great for, staving off dementia and Alzheimer's, etc. And it is a photosynthesizer. So when you pair methylene blue with frequency treatments such as red light therapy, it allows the light to penetrate more deeply into the nucleus and to interact with the DNA. So those are some of the things that we use. I do agree that ozone insufflations are very powerful because it is said in the research that 3 consecutive therapies using ozone, insufflating that can be done vaginally as well for vaginal cancers, etc. But it does get absorbed into the bloodstream, and the ozone breaks down to ozonides, and they are biological response modifiers. So it's amazing. We don't have all of the science yet to tell us exactly how it's working, but we know it works, and it's something that we can measure to see that it is working. So yeah, I mean, we offer a lot of the modalities that is offered by Dr. Verano, her medical clinic there. I also have a master's degree in traditional Chinese medicine and acupuncture, so that becomes part of my toolbox as well. And not just, I think what I really want to emphasize is that we can do so much for the physical body. We spoke about food, etc., to change the terrain, right? And that is the epigenetics. Our lifestyle can supersede whatever our genetic predispositions are to cancer. And so, getting exposure to direct sunlight, they recommend, getting exposure at sunrise, right? I have an app that I recommend for my patients called D-Minder, and it allows us, as we transition through the seasons, to know exactly what time sunrise is. And I encourage them to go out and expose their bodies to sunlight. But, those are some of the things I'm talking about epigenetically. And yes, some of the tests that we have, I do not use RGCC, but I do use a similar test. I have some questions about, the blood being flown to Greece and, and the fact that the cells are grown out on calf serum. And again, there are differences between practitioners. But we do use a company that offers the same thing, and they're able to look at or test different naturopathic and integrative substances, against the tumor cells themselves, and they're able to measure the percentage of cytotoxicity of these agents. They're also able to test mistletoe, which strain of mistletoe, because mistletoe differs depending on the host tree, because it's a semi-parasitic plant, but it's prepared homeopathically. So it tends to go well with, radiation or any other standard of care that you're receiving. But there's a way for them to identify which substances have the greatest cytotoxic effect. We also do CBD. So we do CBD infusions. We offer that to our patients because it's a really amazing immune modulator, and it has no THC. So, my patients do not need to worry about, the psychotic effects that can come from THC. But again, everything is personalized to the patient, and I really want to emphasize that. And also, we have to take into consideration what their standard of care therapy is, because that takes precedence. And so we don't want to do anything that's going to interfere with the cytochrome P450, which is that enzymatic pathway by which certain things get processed out of the body. We don't want to either clear the drug too quickly that they're receiving, and we don't want it to hang around or linger for too long, because that can make the drug become more toxic. So we need to look at the person again as a whole, from a holistic standpoint, the person who is serving as host to the disease, and not just hone in on the disease, which is what, that is the training of the standard of care, the oncologist. And they're brilliant people, and, I give them their just deserved, but the training tends to be unilateral. So coming as a naturopath or an integrative oncologist, we're looking at the person as a whole. And I also want to emphasize that the mind is extremely powerful. Right. There are studies and, experiments that have been ran where, people can heal themselves. They can shrink tumors just by visualizing the tumor shrinking every day. And we have proof, and we've seen that is a possibility. So, just nurturing the spirit and having, people to, the thoughts generate an energy. What we hold in our hearts generates an energy. What we utter with our lips and our mouth generates an energy. So there is the placebo effect where, a person can be given a sugar pill, and they believe that sugar pill is going to heal them, and guess what? They heal. But there's the opposite of that, which is the nocebo effect, where you can throw everything but the kitchen sink at a patient, but if they don't believe that, they either deserve to heal or that they can be healed, then it doesn't happen. So.
Yeah. I mean, I did a lot of work with Dr. Bernie Siegel. I'm sure most people are familiar with him. When I first started Natural Nutmeg, actually, he was writing for us, and I'll never forget, like, just a lot of the things he wrote about and the things that he said in terms of how impactful the words that you say to yourself, the words that other people say to you, the thoughts that you think can be on not only cancer diagnosis, but any kind of chronic disease. Literally, it's what what you believe is what will happen, right? And that's why I said earlier, you are not your disease. Like, I really want people to embody that. You are not the diagnosis. You are not the disease. And stop saying, just be mindful of the words that you say to yourself that, people say to you, including that the doctors say to you. Like, Bernie was great. He was like a big advocate about what doctors should and shouldn't say to their patients, because, he fully believed that. So we just have a couple more minutes before we finish up. I wanted to actually just switch gears a little bit and talk about cancer prevention. So there are so many tests out there now, like genetic tests, all those kinds of things that can tell us whether we will be predetermined or more predisposed or whatever. So, Karina, I'll go back to you. Like, what do you think about that? Like, should we be going out and getting all these tests? Are there some tests that you think would be very, beneficial for people to have? Or is it more like, what, like, you don't put that energy like in your head? What do you think about that?
Yeah, so there are some tests that I recommend everyone do, like either once a year, every other year, because what's happening with all of the increase. So when I was growing up, we didn't have cell phones, we didn't have Wi-Fi, we didn't have Bluetooth, we didn't have all of these frequencies going past us and through us and around us. And so one of my personal theories is that all of these frequencies are increasing things like mycotoxicosis, because for some reason mold spores are growing faster than they've ever grown before. So what in our environment has shifted and what's changed? And my what I can rationalize is all of these new waves and frequencies and signals that have developed even since I was younger. So I find that pretty much 10 times out of 10, when a cancer cell grows and mutates and establishes a malignancy, there's usually internal factors that support that, either toxicity with mycotoxins, a chemical exposure or chemical that's built up in the system, a heavy metal that's built up in the system because of a chronic exposure or ingestion, a chronic infectious process that's dysregulating the immune system. So my go-to is to look for toxic levels of mycotoxins, chemicals, heavy metals, or a chronic underlying infectious process that was never diagnosed and treated, typically in the GI tract. Because it may not be enough to be super symptomatic. So someone may not present to a gastroenterologist or a PCP with symptoms, but it's dysregulating their immune system. So I'm finding that people have pretty much every person that I test who has cancer has a toxic level of something in their system. So we identify the exposure, the source, where they got it from, and then we eliminate the source and then treat their body to detox it out. So as a prevention tool, all of my patients who come in with like a family history or fear of developing cancer in their lifetime, we work on, of course, diet and lifestyle to decrease systemic inflammation, get their lifestyle, get them exercising program, and then also do testing to look at what toxicities may be in your system that need to be detoxed out, or what chronic infectious process is in your GI tract that maybe need to be treated. Mm-hmm. And it leads to other issues too, not just cancer, but I had a patient who had the testing that would be a perfect environment for cancer cells to grow. The only symptom she had was infertility. And so she came to me initially for infertility. She had two raging infections in her GI tract. We cleared the infections. We treated her for a mycotoxin that was at an extremely high level in her system, and she got pregnant as soon as she was done with the treatment protocol. Wow. So it's not just, yes, it's cancer prevention, but it's also other illnesses and issues within the body that resolve just by clearing chronic infections or chronic viral infections. It doesn't have to be bacterial, but chronic bacterial viral infections, and then also toxins and chemical exposures.
Right. Awesome. Yvette, how about you?
So, there are oncoviruses that we know can predispose one to a greater risk of cancer. So we do look at, Epstein-Barr virus antibodies, especially the antigen D antibody. We look for a cytomegalovirus antibody. This is the virus that causes chronic fatigue syndrome. I often see a lot of times patients who have elevated antibodies for Mycoplasma pneumoniae. So we look at those possible oncoviruses that can be contributing to immune dysregulation. So that's very important as well in terms of root cause. Mold is huge. And then even like, hypoxia, how many of us we're so stressed, and with the environment that we're living in now, the environment of fear and uncertainty, people are shallow breathing, right? And so, that's generating hypoxia, right? So when you have a low oxygen environment, then, your tendency is to fermentation for energy, which is very typical of the cancer cells. So just simply being conscious and cognizant of how you're breathing. I'm very, very happy that, I my wish list on my wish list was a hyperbaric oxygen chamber, but there are other forms of oxygen treatment as well. But just making sure that you're breathing enough and you're getting enough air into your lungs and oxygenating your body. That's also important. But I just wanted to talk about one thing before we end. If I don't get another turn, I wanted to mention this. So I just received my certification in peptide therapy, and peptides are 40 sequences or less of amino acids. And so there are a couple of peptides that we're getting more research coming forward with how they can benefit or cancer patients or patients with a cancer diagnosis. And one of them is that BCN, I think, yeah, BCN 27. And BCN 27, what it actually does is it pokes holes in the cell membrane of the cancer cell, so it's not able to to hold its pressure, and so the cell will go into apoptosis. And the other peptide that's showing really good promise is the TA1, which is the thymosin A1, and its ability to activate the natural killer cells, which are those cells that directly go after the cancer cells, right? Or interact, let me say, with the cancer cells and cause those cancer cells, if they can't revert back to normal, cause them to move forward to program cell death. So the peptides are emerging. I would not use a peptide such as the what is it, BCM 157, because that increases angiogenesis. So you have to be strategic in what you're recommending. Know the patient. I can't emphasize enough. Know the patient who is sitting in front of you, and test. Don't guess, as Naisha says. Test, don't guess. I always say my own way of saying this is, when in doubt, find out, but get to know the patient. That's what I would add to that.
Awesome. So before we go, Yvette, how do you want people to get in touch with you? Is the best way to your website, or do you have any contact information, anything that you want to let people
through
know?
my website at adeniohw.com. Our local number for the front desk is 203-220-8849. And we do have a toll-free number as well. I like that toll-free number because if I'm not physically in the office, it does transfer to my cell phone, and that's the 888-655-8489 number. So we're happy to answer any questions that you might have. I am offering a 15-minute discovery call, so please take advantage of that.
Awesome. Thank you so, so much. And
You're welcome.
Corrine, how about you?
Yes, the easiest way is through our website. We have online scheduling. You can also call our front desk. We have two office managers who are wonderful. The telephone number is 860-471-1434. I also have a direct clinic line. It's 860-530-7099. However, I probably won't answer during business hours because I'm with people. But through the website is a good source. We have information on scheduling. We do a 15-minute no charge prospect call, and then also for the purpose of this this panel series, we're doing a 10% off an office visit. So if you're interested in calling and doing a 15-minute prospect call, or having an office visit to discuss any health concerns further, it would be 10% off for you.
Okay, awesome. Thank you so much. And I put all that information in the chat. So we probably should have this recording done by the end of the week or early next week. When I send that out, I'll also include both of your information in the chat as well. If anybody has any quick questions, please just pop them in the chat right now. I know I had Elizabeth said, this was a little while ago, but we were in the middle of questions. She said, "Well said, Dr. Witten, that the healer lies within. I've never felt comfortable with the quote fighting cancer." Yep, the healer lies within, right? It's all about, your thoughts and what you focus on for sure. Awesome. Yeah. Well, I want to thank you both, Dr. Witten and Dr. Verano. This has been an enlightening, very fascinating conversation. Lots of great information. I want to thank all of you guys for joining the call too. And we'll get this recording off to you soon. I hope everybody has.
And I just want to say to you, Diane, what you do for our community is amazing.
Oh,
and
thank you.
I cannot thank you enough. So thank you.
Thank you. That's why I do it.
Yeah.
It's to get you guys out there and get all this great information out there as well. What Lois is asking, do you treat other conditions besides cancer, either of you?
Absolutely. Yeah. We treat the person, right? So we're looking at the root cause of disease. And so it doesn't have to be cancer. What we're trying to do is work with you to optimize your health.
Yeah, for the purpose of this panel, we focused on our oncology practice, but I also have a pediatric clinic, women's health, and family health and wellness as well.
Awesome. And Melissa says, "Thank you for providing the natural care and resources. This is helping real healing." Yes, everyone on the call will get the link to the full video through email. Yep, I have everybody on the call, and we send it out to our entire email list anyway. So if you got on this call, you're more than likely on our email list, so you'll get the full recording. Awesome. Everybody's saying thank you. So thank you, ladies, again. This is great.
Thank you, Diane, so much for hosting. This is awesome.
Oh, you're so welcome. You're so welcome. All right. Hope everybody has a great rest of your night.